Employee and student health is an incredibly important thing as we look to returning to school. In fact, over half the families who responded to the survey said that having regular symptom checks for staff and students would make them more comfortable sending their child to school. What protocols and procedures will the schools be implementing in order to protect both students and staff?
Health and safety of students, health and safety of staff is truly one of our #1 priorities. We have developed very strict protocols for health and safety standards for all faculty and staff to follow. We have created checklists so that there's no confusion about what staff are required and expected to do on a daily basis, both with students as well as just within the classroom itself, because the classroom itself becomes such an important part of a student's day. In addition, we are asking families to help us with something that we know we can't reasonably accomplish every day, and that is this. We are going to be asking parents to monitor their students' health every morning, take their child's temperature, and ensure that the COVID-like symptoms, according to the CDC, are not being experienced by that child. And if they are, we ask our parents to keep their kids home that day. It is okay to keep kids home. In fact, it's very necessary to do that because we absolutely want to reduce the risk of infection so that kids can be in school 5 days a week or whatever that schedule is. We do not want to close school again. And we want our kids here. We want them to be safe. We want them to be engaged with their teachers. And in order to do that, we need to ask our families to help us with that. We also know that some families may not have easy access to a thermometer all the time, or they might forget. And one of the things that we will do then and offer for families is if there is not a way for their child's temperature to be taken, please call the school office, because our school office staff, the administrative team, and the secretarial team in the offices will be happy to assist to make sure that we are confident that the student is healthy and safe and ready to go back to work, go back to school.
How will the schools work to promote behaviors that reduce the spread of COVID-19?
I think what you're asking is, what are we going to do from a facilities perspective to disinfect and to make sure that the building itself is as clean of infection as possible? We have instituted some very specific cleaning protocols that our facilities team, our custodians, and those that manage the building and clean it daily will be instituting. All hard surfaces are going to be wiped down periodically throughout the course of every day. Teachers will be asked, and in some cases students will be asked, to wipe down their desks or tables after each class period, if in fact, like at the high school, kids are going between classes. Our doors will be kept propped open, and yes, that does include bathroom doors in the hallways. They will be propped open to reduce the need to have to open doors and use your hands to touch those things. All employees will be required, per the governor's executive order, to wear masks during the course of an instructional day. And depending on the age of students, students will be required, as long as we are in phase 4, to be wearing masks throughout the course of the day as well. Young children, preschool through grade 5, are not going to be required to wear masks during the day, but will be required to wear masks during passing times, like if they're going on their way to get food from the food service distribution area, and things of that nature. So there are a variety of things that we're instituting. I also will say that once a week, each classroom, we have purchased some special disinfecting cleaning equipment, including fogger systems that they wear on their back and they spray around. They'll be doing that weekly in every classroom, and those are intended to give a thorough disinfecting procedure to every classroom, tabletops, chairs, walls, whiteboards, what you name it, it'll be fogged.
What happens if a student or staff member becomes ill at school?
If a student is exhibiting COVID-like symptoms. Does not mean the student has COVID-19, but if the student is experiencing COVID-like symptoms during the course of a school day, the student will immediately be escorted and put in an isolation room until a parent or guardian can pick that student up. Now, for high school kids, that oftentimes they drive themselves, they will be sent home if they're experiencing those symptoms. The most important thing, however, I think is the follow-up. So then what? And the then what, we already have a protocol in place, and this is what we will do. If that student goes home with those symptoms, the teacher will be required with her students or his students to move to a neutral, cleaned, disinfected classroom for the remaining portion of that day. School will go on, learning will continue, and the room that they vacated, their traditional home room, will be locked and secured for 24 hours, which then will be cleaned the following morning. And that's coming directly from the Kent County Health Department as the expected protocol, and it is the protocol that we will be instituting. After that room has been disinfected, students will then return to their regular homeroom. So they could be out of their regular traditional homeroom for up to a day and a half, perhaps, allowing the 24-hour period, and then the cleaning and disinfecting the following morning.
How will the school monitor and inform families if any positive cases of COVID-19 are confirmed within the school community?
School staff have been barred from communicating specific information about a student or a staff member that has tested positive for COVID-19. We are disallowed by state regulations and federal regulations from communicating the specific circumstance. However, we are required and we will contact the Kent County Health Department in the event somebody tests positive and we're made aware of that. It is then on the Kent County Health Department's plate to begin or initiate contact tracing and also to communicate to the individuals that need to be communicated to the specific information about that. We are still learning, so I can't answer specifically what will happen as it relates to school continuing or not continuing if that happens and when that, if in fact that would occur. We're getting that information, and we certainly will continue to get that information over the course of the summer months and certainly well before school starts on August 19.
What, if any, accommodations will be made for medically vulnerable students or staff members?
There are students and staff that would perhaps have one of the identified underlying medical conditions that the CDC has already released. Those conditions create a need for us to be able to accommodate both those students learning if they're not able to be in school, as well as for the staff who may have some of those underlying conditions in terms of whether they can or cannot be on campus. And we'll be working closely with faculty and staff in particular. We've already asked our faculty and staff to let us know if they have any of the identified medical conditions. Students is about learning. It's about teaching them and it's about their learning. And the most important thing for students is that if they do exhibit some of those conditions, we will absolutely provide ongoing classroom instructional support to them in the event that they're not able to be at school. So we're putting plans in place, and we want to make sure kids are learning, and we want to do all we can to support them.
From the parent survey, 88% of families indicated that they would send their child to school if in-person instruction is allowed, and even if masks are required. Will students and staff members be required to wear face masks while at school?
The answer is yes, and the answer is perhaps. Yes, they will be required to wear masks as long as we remain in phase 4, and that's where we are now. Perhaps they will be required to wear masks if we move to phases 5 and perhaps even to phase 6 over the course of this late summer, early fall. So that's been answered for us by the governor through her executive order. Please know that preschool, kindergarten, first, second, third, fourth, and fifth graders will not be required to wear masks during instruction. However, they will be required to wear masks according to the current order in phase 4 to wear masks during passing times and things of that nature. I talked to a parent last night. It was kind of a neat conversation, actually, and what she said to me was this, and it meant a lot to me, actually. She said, you know, we're prepared as a family to make sacrifices and to institute various forms of accommodations in order to get our kids back in school. We know they need to be in school, and we want our kids to be in school, and if it means that we have to take some measures as a parent, as a family, we'll do that, because the education of our kids is so important. We're willing to do that. Now it's a great story. One of the questions on our parent survey that we found very interesting was a question on the social and emotional well-being of kids. That became very evident to us during the time of school closure on March 17. And one of the things we would hear, and we would read in the media, but we would hear from our families, is how it was taxing, it was hard. Kids missed their friends, kids missed their teachers, teachers missed their kids. Parents weren't sure how to navigate all this new social distancing thing, and so that was not surprising that kind of information came out. And one of the things that we instituted during school closure that was unique, I think, but very important, was we had our social workers and our counselors reaching out to kids and touching base with them to making sure they were engaging and also engaged in just their lives and within their family communities. And of course, in a Christian school, prayer is the most important thing we can do for these kids and for our students. And there were prayers being raised daily for our students, for our families, for our faculty, and for our community to be able to get through this and to navigate this in a healthy and meaningful way. So social, emotional, spiritual well-being of kids is a high priority to us. It was during closure, it was prior to closure, and it will continue to be a very high priority for us as we return to school again on August 19.